Born in Garland, Texas, Dr. Jay Burns is one of the elite surgeons for the Dallas Plastic Surgery Institute. His philosophy, do it right the first time.
I don't do anything in my practice that has the word mini in it. What I've discovered over the years is people are like me. They want a mini recovery, a mini price, but at the end of the day, I haven't seen anybody that wants a mini result. I think a facelift can last anywhere, depending on your tissue, 8 to 12 years. Not all skin is created equal, so I can do the same facelift, but if I'm working with tissue paper or Kevlar, it's a different product. But you can get the best result in the people that have tissue paper or Kevlar if you do the right procedure. And my philosophy is that right up front, I say, you know what, when we're all done, I want to have a good relationship, we'll give each other a hug and say, you know, it was a great experience, and then you don't need to see me again for 8 to 12 years. When I do it, it'll be a recovery that'll be several weeks before you feel comfortable at a dinner party, but when it's done, it will be a thorough dissection, a thorough operation that will make you look uniform and unoperated on. I'd love to be like a stealth bomber. I mean, I want to get in, get out, and never know you were hit.
Dr. Burns achieves this natural look through his understanding of the aging process.
If you do a little dissection, some people just kind of lift the skin up a little ways and pull back. Think about it for a minute. That's not how we age. Our whole face ages. So people might think, well, I like this guy because he's going to do a little bit of this and not do too much. Well, if you don't do too much, then you only do part of the face and the whole face is aged. And to be honest with you, it seems contradictory, but that can look weirder than just doing the full dissection, which sounds scary. But if the whole face has dropped, you have to kind of dissect the whole face to pull it north-south, not east-west. That's not how we age.
Take patient Jane, for example.
Well, Jane is one of those patients that waited a while. She was just like me. You know, we didn't put any sunscreen on growing up. In fact, put the oil on. And she's just a few weeks out from a facelift, and it's a little earlier in the healing process. And we did a combination on her. We did really everything you can do. She had damaged skin, so we did a full face laser resurfacing with me doing it. At the same time, we did a facelift, full face, neck, brow, eyes. It is the total facial rejuvenation.
I had several friends who have had the procedure done, and I interviewed several different doctors, but when I saw Dr. Burns, it just clicked. I knew he was the right man to do the job. He came across to me as a real person, open, friendly, had my best interest at heart.
Dr. Burns encourages all of his patients to do their homework.
People think they're coming and interviewing me, and they should. I don't mind second opinions. The more they know about me, the better I like it. But I'm interviewing them. I don't want to take advantage of someone that's in jeopardy socially. I want to encourage them to what they really need. The first thing to do is, do they really need it? Are they really mentally okay to tolerate it? Because I can tell you, going through a facelift is a very challenging thing psychologically and emotionally. I mean, this is your face. This is who you are. This is what you present to the world. And you got to have trust in the doctor. And I never, ever take that for granted.
A lot of people I know are hesitant, but it's so worth it. It really is.
I would say don't hesitate. He's the man for the job.